It goes. As I promised, every week there will be a new lecture. So AIM4PG today presenting ketogenic or keto diet. Now you can see that it is so much trending that keto diet to take for weight losing. So I have told that every week I'll be giving new diet chart like for diabetic, for hypertension, for kidney disease and everything, and weight loss also. So every week I'll be giving diet chart for all the diseases, what to eat, what not to eat, with proper PDF. So this week we are starting with keto diet, the most trending topic and most trending diet everyone is following. So first, going to the keto diet, I have given a keto chart like what we have to eat in breakfast, lunch and everything. So before that we should know what is keto diet. So it is like it involves drastically reducing carbohydrate intake and replacing it with fat. This reduction in carbs put your body into a metabolic state called ketosis. When this happens, your body becomes incredibly efficient at burning fat for energy. It also turns fat into ketones in the liver, which can supply energy to the brain. Ketogenic diets can cause significant reduction in blood sugar level and insulin level also. This, along with the increased ketones, has some health benefits too. Ketosis is a metabolic state in which your body uses fat for fuel instead of carbs. It occurs significantly reduced consumption of carbohydrates, limiting your body supply of glucose, which is the main source of energy for the cells. Following ketogenic diet is the most effective way to enter ketosis. Generally, this involves limiting carbs consumption to around 20 to 50 grams per day and filling up fats such as meat, fish, eggs, nuts, and healthy oils. It's most important to moderate your protein consumption. This is because protein can be converted into glucose if consumed in high amount, and which may slow your transition into ketosis. Practicing intermittent fasting could also help in entering into ketosis faster. There are many different forms of intermittent fasting, but the most common method involves limiting food intake around 8 hours per day and fasting for the remaining 16 hours, which is 24 hours. Blood, urine, and blood tests are available, which determines you enter into ketosis or not, and how much amount of ketones produced by your body. Certain symptoms may also indicate that you have entered into ketosis, like increased thirst, dry mouth, frequent urination, and decreased hunger or appetite. Now, ketogenic diet is one effective way to lose weight and lower uh, the risk factor for disease. Now, some researchers found that ketogenic diet may be effective and weight loss diet plan as a low fat diet. What's more, the diet is also feeling that you can lose weight without counting calories or tracking your food intake. One of the studies showed that very low carb ketogenic diet is slightly more effective for long term weight loss than a low fat diet. People who followed keto diet lost average 2 pounds more than the group that followed a low fat diet. And more also, this lead to reduction of diastolic blood pressure and triglyceride levels. And also studies shows that a 34-year-old adult found that who followed a ketogenic diet for 8 weeks lost nearly 5 times than the body fat as who followed the low fat diet. The increased ketones lowers blood sugar level and improve insulin sensitivity, which plays a key role in the weight losing. Now, ketogenic diet for diabetes and prediabetes can be characterized by changing in the metabolism, high blood sugar, and impaired insulin function. The ketogenic diet can help you lose excess fat, which is closely linked to type 2 diabetes, prediabetes, and metabolic syndrome. One older study found that the ketogenic diet improved insulin sensitivity by a whopping 75%. A small study in women with type 2 diabetes also found that the following a ketogenic diet for 90 days significantly reduced level of hemoglobin A1C, that is HbA1c, which is measure of long-term blood sugar management. And the study of 349 people with diabetes 2, type 2 diabetes, found that who followed a ketogenic diet lost average 26.2 pounds. It is approximately 12 kg we can see for a 2 years period. This is most benefit when considering the link between weight and type 2 diabetes. There's more, they also experience improved blood sugar management and the use of certain blood sugar medication decreased among participants throughout the course of study. Now, the ketogenic diet actually originated as a tool for treating neurological disease such as epilepsy also. Studies have shown that the diet can be beneficial for a wide range of healthy health conditions like heart disease. The ketogenic diet can improve risk of body fat, HDL, cholesterol level, pressure, and blood sugar level. And also it is helpful to for the cancer patient because the diet is currently being explored as additional treatment for cancer because it helps in slow tumor growth. And in Alzheimer's disease, the keto diet may help reduce symptoms of Alzheimer's disease and slow its progression. Epilepsy research has shown that the keto diet can cause significant reduction in seizure in epileptic children. And in Parkinson's disease also, although some research is needed, one study found that the diet helped improve symptoms in Parkinson's disease. And in polycystic ovary syndrome, the ketogenic diet can reduce insulin level, which may play a key role in the polycystic ovary syndrome. And in some brain injuries condition, some research suggests that the diet could improve outcome of traumatic brain injuries. Although ketogenic diet usually safe for healthy people, but it has some side effect also. There are some anecdotal evidence that this effect, often referred as the keto flu. Based on the reports, some of the eating plan is usually over few weeks. Reports keto flu includes diarrhea, constipation, and vomiting. Other less common symptoms include poor energy and mental function, increased hunger, sleep issues, nausea, digestive discomfort, decreased exercise performance. To minimize this, you can try regular low carb diet for the first few weeks. This may teach your body to burn more fat before you complete eliminate carbs. Ketogenic diet also change the water and mineral balance in your body, so adding extra salt to your meal or taking mineral supplements may help. For that, you can suggest or take help of a doctor about your nutritional needs. At least in the beginning, it's important to eat until you are full and avoid restriction calories too much. Usually, ketogenic diet causes weight loss without intentional calorie restriction. Now, ketogenic diet on a long term may have negative, like the risk low protein in the blood, extra fat in the liver, kidney stones, micronutrients deficiency. A type of medication called sodium glucose co-transporter 2 inhibits of type 2 diabetes can increase the risk of diabetic ketosis, a dangerous condition that increase blood acidities. Anyone taking this medication should avoid keto diet. Now, if you want to know about diabetic ketoacidosis, in previous lecture I told about that. You can see the other videos in the M4PG YouTube channel. In the side, I've given some keto diet foods. You can look at it. Now the main part, keto diet chart. Let's discuss. And we should avoid, when you are in keto diet, you should avoid chapatis, bread, rice, carbohydrate, dal, milk, maida. Increase the intake of protein-rich foods like fish, egg white, green vegetable. Avoid taking refined flour, packaged food like white or brown bread, biscuits, any ready-made packed food. Avoid sugar and all sugary foods, but you can take artificial sweeteners. Any sweet and food having sweet also should be avoided. And what you should take is in oils, you can take mixture of olive oil, mustard oil, and coconut oil, homemade white butter. Food like non-vegetarian food, you can take egg white, fish, seafood, chicken breast. Take one egg yellow daily, you can take it. Paneer, cream cheese, tofu. Tofu is made from the soya milk, you know it. Nuts like almond, walnut, pecan nut, macadamia nut, coconut, pumpkin seed, flax seed. Other types of vegetable you can take like any vegetable that is grown above the ground. That is more helpful. Not below the ground vegetables are helpful. So vegetable like cauliflower, cabbage, cucumber, broccoli, zucchini are helpful because it is grown above the ground. Fruits like kiwi, kharbuja, peach, berries like strawberry, blueberry, coconut water, coconut malai that is inside the coconut. Use air fry, no salt, no oil food. Take only one roti made out of millets, bajra, jawar or ragi. Now this is the diet plan. In morning, in breakfast, what you should take? Out of three, you can take one cheese, three hard-boiled egg, black tea, coffee. coffee or coconut water or coconut malai, or you can take 3 to 4 egg bhurji, 1 egg yellow only, and uh, add with palak to it, cooked in 1 tablespoon of coconut oil plus black tea or coffee you can take, or you can take 100 gram paneer scrambled with capsicum and tomatoes, cooked in 1 tablespoon of almond oil or mustard oil plus tea or coffee. In mild morning, like at around 9, 10 or 11 o'clock, you can take 4 to 5 almonds, walnut plus 1 black coffee mixed with 1 spoon of desi ghee or 1 spoon of coconut oil. For lunch, you can take 50 gram of cream mixed with palak and stir fried broccoli or cauliflower or any mixture of vegetable. Or you can take 100 gram grilled chicken or fish in oil with onion pepper mixed with 2 tablespoons of olive oil or coconut water. Evening, or if you're doing workout, you can take the post workout like coconut water or coconut malai, almonds, walnut, pecan nut, macadamia nut. And dinner you can choose from like 4 egg bhurji cooked in 1 tablespoon of oil or with grilled vegetable, or you can take grilled fish in oil with vegetable, or you can take grilled chicken in oil with vegetable you can take. Inside also I given week 1, week 2, week 3, week 4 what you can do. So that is it. Thank you. And this was the presentation from m4pg.com. Also, these all PDF I will be sharing with M4PG Telegram group. Make sure to join it. Other diet charts I will be sharing, like for hypertension, for diabetes, for renal disease, all the diet charts and everything I will be showing in PDF. I'll be sharing with you also in M4PG Telegram group, M4PG Telegram notes group. I will be sharing. That's for it. So meet you in next week for with the new lectures. Thank you. That's it. Have a good keto diet and lose your weight.